Hello, everyone. Welcome to Science Ask a Neurologist podcast. My name is Anjali Goyal. I'm a third-year medical student here at New York Medical College. Today, I have the pleasure of interviewing Dr. Adam Karp, who is currently an attending vascular neurologist and neurohospitalist at Good Samaritan Hospital, and also serves as the director of the Brain and Behavior course here at New York Medical College. Dr. Karp, thank you so much for joining us. We're so excited to have you.
Thank you for having me. Excited to be able to talk to everyone.
To get started, do you mind just telling us a little bit about yourself and also your journey to becoming a physician?
Absolutely. So I grew up in New Jersey. I've been pretty local most of my life. Went to medical school at New York Medical College. I graduated a number of years ago now. Before medical school, I was interested in neurosciences and did a lot of neurophilosophy work and going through a lot of those kinds of fields as a college student. When I got to medical school, I did a full, really tried to dig in the dirt and get a sense of all different fields. I started off thinking maybe neurology, and then I decided I didn't want to do neurology, and ended up switching over to thinking I was going to do maybe surgery or a GI. I canceled my third year neurology rotation at one point to do a GI elective instead. Did not enjoy it, did not like that for myself, and ended up going back and doing a neurology rotation anyway, which I obviously loved. So I had a little bit of a circuitous path there, which I thought was honestly good experience to be able to get a sense of what I really wanted to do. I did my, after graduating New York Med, I did my residency training and fellowship training at Mount Sinai Hospital in New York City, and trained as a vascular neurologist, which I am excited to be part of that department now with Westchester.
Thank you for sharing that. It's great to also have a New York Med alumni on here, so that's awesome. And can you just tell us a little bit about what made you decide neurology as your specific specialty?
Absolutely. I really enjoy neurology for a couple reasons. I think it's a really exciting field to be a part of. It's growing in a lot of different directions, and it gives you an opportunity to kind of think about things in a little bit more of a puzzle way than, as I describe it, than some other fields. We really get to see a patient and try to link back and localize, and that's our first step in diagnosis, is being able to localize and being able to see what part of the brain or what part of the nervous system we think is being affected. I find that really exciting to be so reliant on the physical exam and so reliant on what I'm seeing at the bedside, to be able to make clinical decisions. On top of that, like I said, it's growing in a lot of different directions. If you go back a couple of years, everyone would have heard the phrase diagnose and adios, for neurology, which I think is really inaccurate now. And we can do so much more. In the past 20 years, I'd say we've had a huge growth in terms of the medications we can use for all different things. Stroke care has revolutionized in the past 20 years. In the year 2000, the idea of a stroke code didn't exist. We didn't have acute stroke medications. The first Alteplase trial or TPA trial had just come out a couple of years before that. It hadn't become widespread yet. So that really just shows how recent a lot of these developments are and how much we're continuing to grow and expand. We're discovering how to treat some conditions that within our lifetimes we're not able to be treated. It didn't have any options for patients, and we're now able to give patients really great outcomes for some of these terrible, terrible conditions. So I find that really exciting to be on the forefront of, and on the forefront of trying to bring out some of these treatments to different communities, and to communities that are a little further away from academic medical centers, where we can be able to help patients get treated close to home, and bring the treatments to where they need it.
Yeah, thank you for sharing that. I find that very insightful and very accurate how neurology is evolving so much. Even the last 20 years, we've come up with so many new therapeutics and biologics for treatments that didn't really have that many treatments available for them. It's like MS, even Alzheimer's now, there's so many new treatments available. To go off of that interest in neurology, you're also an expert in stroke care. How did you develop an interest to go into that subspecialty?
So stroke, as if you haven't heard, I've already been mentioning a lot about how stroke has grown and really expanded and what we can do for our patients. I find that acute stroke care really exciting. And I think it's a really hard field to be in. You're making some very quick split-second decisions that can mean life or death. And that's a hard thing to be able to do, and it's a hard responsibility, but I find it very exciting. I think it's very interesting to be able to be with the patients in those moments. and to be able to work with them in these really terrifying moments. Somebody who just came in and suddenly can't speak, and now you're the one there explaining to them what happened and what we might be able to do about it and the risks associated. I think it's really interesting and exciting to see how acute stroke care has changed, but also how long-term stroke care has changed, and our understanding of the disease process and our understanding of how what we can do to try to prevent stroke in different patient populations. We have numerous trials that have come out in both worlds, in both the acute and the chronic world, which makes it really active engagement to be able to stay abreast of all of these new trials and stay abreast of all of these things that are changing how we practice. Even in the past year of me doing when I was a fellow, from the beginning of the year to the end of the year, there were pieces of our practice that changed based on trials that came out. That's just how active and readily we're changing and trying to acclimate to new literature and trying to learn more about our disease process, which I find exciting to be a part of, and really inspiring to be able to offer to our patients.
Yeah. Something that I'm really curious about learning is what's been the most rewarding patient care experience that you've had? I know you've probably had a lot, but if you could just think of one that's particularly shaped your career and, even changed the way you might practice medicine.
There's plenty. I think in stroke care, especially, we get so many opportunities to change people's lives. And sometimes it's for the worse and they have a poor outcome, but sometimes it's really, and more now as we develop more treatments, it's for the better, and we can really save their life and bring them back to what they were doing before. I had one patient when I was resident that came in one morning with right-sided weakness, inability to speak, completely aphasic. He was actually a carpenter, and this happened while he was in his wood shop. His wife gave a great history. His son was actually a stroke physician out in Texas.
Wow.
And so he was hopping on the phone and giving a great history. I was able to give him TNK within 8 minutes of hospital arrival. It was my fastest time I've ever gotten. We got the scan right away. We had great history. We were able to give him TNK. And about 2 hours after that, he was totally back to baseline.
Wow.
When I walked into the room the next day, his wife came running up to me to give me the biggest hug, in tears of just how happy she was to be able to talk to him again. And it was really an inspiring moment to be able to be a part of that and to be able to give him back his life and take him from being what would have been probably nursing home bound to going back to his wood shop on discharge with some cautions about what he was doing there. But it was really inspiring to be able to do that for him.
Yeah, that's amazing that you were able to help his family. And obviously they were so grateful and thankful, and that must feel very, very rewarding. And, something that I'm also curious about is, because this field can be so demanding, how do you maintain a work-life balance and how do you tackle burnout? I know like these experiences can sometimes remind us why we chose this field, but obviously residency can be so tough. So how do you find that balance?
That's a really great question. And I think that's really important to kind of think about in all fields of medicine of how we're going to strike that balance. And it's a balance that's always changing and always a moving target of what we are able to do and what we need to do for our patients and for ourselves. But not forgetting about yourself is definitely crucial in being able to continue to offer care for your patients. For me personally, I find it really important to have some time that I separate away from medicine and that I can turn off some of those things. My wife has nothing to do with medicine, and she's very good at telling me to be quiet and to stop talking about cases, and make sure that I'm still thinking about things that are not patient related. And I think that's really important to be able to give myself a little bit of space so that when I come back into the office or I come back into the hospital, I can work with a fresh mind. That's especially important after some cases that don't go as well, and end up having complications, and being able to internalize that and separate a little bit from it to be able to reframe on what I'm doing, and making sure that I am confident and comfortable with what I'm doing every day, as I keep treating more patients. Everyone's got a different way that they're going to be able to separate, and different things that are going to make them happy. One word of wisdom I got as a medical student from one of the people a couple years before me, also a New York med grad, obviously. She turned around to me one time and told me that as a resident, the best advice you could possibly get is to find one time, at least an hour every week, to do something not medicine related that you enjoy, whether it's watching a TV show or getting your hair done or whatever it might be, just 1 hour every week. And I tried to really take that to heart and kept with that every time, every week during training, even when I was on night float and even when I was absolutely exhausted, get home, turn on the TV for maybe half an hour. But I find that really helpful to be able to keep my head on straight and keep moving forward.
That's really helpful. And I feel like many of our listeners are medical students. So I think that they'll really appreciate hearing that perspective.
Mm-hmm.
Switching gears for a second, can you describe what a typical week in your life looks like?
It's a busy week. I typically am covering most days, Monday through Thursday, on the inpatient side at Good Samaritan Hospital, seeing as a neurohospitalist. I see all any neurology patients that come in, and I follow those consults Monday through Thursday. Um, that's the bulk of my time. Fridays, I have more set out towards work at the medical school, some meetings in terms of the stroke division, system wide, as well as any other administrative things that have come up. Um, Additionally, I take call. Usually, it's about once every week or 2 weeks overnight, which can sometimes be busy, sometimes less busy. It depends on what's coming into the hospital, and you can never predict that. Um, and then I'm on call some weekends as well, which are usually Friday through Monday morning for again anything that comes in. As depending on the week, some weeks are more geared towards the medical school and geared towards some education pieces, and some weeks are more geared towards inpatient care. But in setting up my schedule, I really wanted to be a clinician educator as a medical student and as a resident. And so I find it very important and really try to prioritize making sure I set aside that time to be able to work with the students and be able to be involved with the medical school and building out how best we can enhance the curriculum.
Sounds like you have a very good balance between administrative and educational duties as well as your clinical responsibilities at the hospital. And speaking of medical students, do you have any advice for aspiring neurologists like us who want to pursue a career in neurology?
Absolutely. I think neurology is a really great field, and I think it's a lot of being a neurologist and wanting to do neurology is just about having that interest and excitement about the field. The not so well kept secret is that we're all a bunch of nerds, and we all like to spend time with fellow nerds that want to talk about the brain in glorious detail. Once you kind of cross that, there's a huge number of pathways you can go into in neurology. So I would even encourage medical students to try to think through what those different pathways are. You can take neurology in an entirely outpatient spin. I have partners in my practice that are focused almost solely outpatient with headache medicine, for example. They have some great injection procedures and things that they do in the clinic, which can be really interesting. There's neuromuscular, where you build in EMGs and you have a whole set of procedures there. There's epilepsy, which kind of helps to bridge a little bit between inpatient and outpatient, but maybe focus a little bit more outpatient at times. And then you become the EEG expert, and every center needs an EEG expert. You can jump into stroke or neurocritical care and gear more towards an inpatient world. You can go for MS, which is also fascinating, growing in all different ways. So there's really all different ways that you can practice, and trying to think about what type of practice you're going to want to have, and playing with that a little bit as a resident, whether that's trying to see what a clinic day is really like in some of these different fields, or how much you like running around the hospital all day, and how you like to try to navigate your schedule and what things excite you versus stress you out. And different branches of neurology will open up different doors in that regard. But there's a huge need for neurologists in this country, whether that's in the middle of the country and more rural communities versus more in urban centers. There's still a huge need. It's a small world. Everyone has, once you get into the field, everyone kind of overlaps and knows each other in all different ways, which makes conferences a lot of fun. and it gives you a really great connection to people and to physicians nationwide. And building those connections and building that experience in terms of just getting to know people, getting to know your field is really where it's at in ultimately finding a position and finding a job.
Yeah, there definitely is a lot of variety in the field. I think that's what's so intriguing. And it's good to hear that it's a very close-knit community. I feel like that's very, um, like that's a good aspect of it as well. Do you have any, like, is there anything when you were a medical student that you wish you had done differently to prepare you for your career?
That's a really hard question, also. I never know what to answer about doing something differently because I'm really happy with where I ended up. So, what I did worked in some way. Um, I think one thing that I wish I drove home a little in my head a little bit earlier was just the importance of connections and mentorship. And when I was a medical student, I always would think about like, oh, well, I know I need my mentors, and I know I need my mentors right now so that I can get my great letters of recommendation and get my residency application. And then I'm going to go on to residency. I'm going to have new mentors. And that's true, but it's really not the way to look at it. Your mentors now are the ones that are going to be helping you shape your career potentially. My mentor in medical school was Dr. Etienne. And when I was I kept in touch with him as a resident. I saw him at a couple conferences. We kind of kept in the same loop. And then when I went to try to find a position, I sent him an email and asked him if he could send out my CV to different places. He responded saying that he could either send out my CV to different places or hire me himself. So it's just an example of how important it is to have those connections and keep them longitudinally. You never know when those things are going to help. And that might be from someone from medical school. It might be someone from residency. Now, as an attending, I still have I was talking to one of my mentors from residency and fellowship yesterday, actually, about a case, just to go through and kind of discuss a little bit more and get somebody else's thoughts on it. And we do that all the time. And I think that's a really important thing to keep in mind of just making sure you keep those connections because everyone is in this for the same reason. We're all in this to help patients. And that means we're helping patients locally at our institutions, and also we're trying to help people get to where patients need them. And that gives us a really big commonality to continue to mentor and help each other as people go through the field. And one day when you guys are attendings and going into your positions, you'll have the opportunity to mentor the next generation neurologists too.
That's really great advice. And I think you're right, mentorship is so important. It can be pretty daunting as a first or second year medical student just finding that mentor. So what advice would you have for people who want to get that network and want to build connections in the field that they're interested in?
I wouldn't be afraid to just start asking. I think most people around, I can definitely say around NYMC and around Westchester Health, but I think even in other even in other fields and in other institutions, most physicians that are in these worlds and in these careers want to be mentors and they want to work with medical students, and we all enjoy doing this. So don't be afraid to just ask and to reach out and say, "Hey, I'm interested in X, Y, and Z, and what can I do to be able to what can I do to get more involved? Do you have any cases that you want to be able to write up? Are there any research projects you're thinking about? This is my idea." And just start having those conversations. Because the truth is, most of these mentorship conversations aren't a big sit down conversation where we go through career paths and all those things. Most of these conversations are, oh, I just saw this great case and I thought you might be interested in it. Or, oh, I got elected to whatever board spot in my residency institution and just thought I'd let you know. We like to hear that and we like to be involved in those conversations. And that's how you stay in touch with someone. And then when the time comes that you actually have a more substantial question, you've got that relationship already built up.
Thank you. That's really, really helpful. And I know we touched on this a little bit, but and how the field has been changing so much in the last 10, 20 years. How do you envision neurology changing in the next 20 years?
I think in the next 20 years, we're going to have almost a completely different field. And then if you go back 20 years, neurology looks totally different than it does today. As I said before, we didn't have stroke codes. We didn't have where the idea of stroke as an emergency was almost a foreign concept. It was just starting to develop. Um, we didn't have thrombectomy until 10 years ago. We didn't have, at that point, to the early 2000s, I think we had maybe only a handful of MS medications. Now we're up to over 20 different medications. We had a slightly larger handful of anti-epileptic drugs, but we have a huge variety more now. We just got our first FDA-approved Alzheimer's medication about 2-3 years ago now. The field is blowing up, and that's just the start. I think we're going to see a lot of new development. I think stroke is going to change a lot in terms of what we can do in acute stroke care, and what we can do both medically and neurosurgically for these patients. Stroke prevention is going to change. Especially in terms of primary prevention, of education around the community, and management of some of our known stroke risk factors to try to help these things before the stroke happens. I think MS is going to continue to change. Hopefully, at some point, we'll be able to actually get a cure for MS. Right now, we have excellent treatment options, but it doesn't cure the disease. So I think there's a lot of growth there that can still happen. Epilepsy is changing more rapidly than I can even talk about. I think the list goes on. Then the question comes in of AI, which we're already using AI in all different ways in terms of stroke care. I imagine, and in terms of, I should also mention in terms of epilepsy, and sometimes in rapid EEG reads, there's work going on in having AI be able to scan EEGs. That's something that I think will continue to develop. I don't think it's going to replace us as neurologists, but I think it will help us in a lot of ways. And I think 20 years from now, what those ways will be can be hard to predict.
Wow. I'm like processing all of that because it's very inspiring how much it's changed, but it's also really interesting to think about how it will change in the future. And I think you're exactly right. There's going to be so many new advancements. And that's really exciting. My last question is, what's your favorite part of the brain?
I wish I had thought about that earlier.
Take
There's
some
so many
time.
parts I enjoy. Um, I am I really like the speech centers. I like Broca's area especially, and I find Wernicke's area interesting as well. But I really like the speech centers in terms of just I find it fascinating what lesions to a speech center can cause and what different aphasias look like. And just thinking about not only what the aphasias look like, but how patients communicate with an aphasia. I find it really fascinating when I go see a patient with an expressive aphasia and you have them sing, they can often sing a little bit better and get the words out a little bit easier. I find those things really fascinating, just thinking about those pathways. So I'll go with some of the speech centers. I'm not being very specific there, but I'll go with that.
That's a good answer. I remember we saw a patient together that had Wernicke's aphasia, and just seeing that in real life when you hear about it in the textbooks is so different and so interesting to see.
Yeah, the phenomenology of some of these neurologic diagnoses and disease states is really fascinating. That's a whole other podcast, but I think it's really fascinating in terms of what patients' experiences are with some of these conditions. And until you see it in real life, until you actually see a patient with some of these things, you don't know necessarily what you're dealing with, and you don't
Yeah.
necessarily, it doesn't mean as much as when you read it in the book.
Yeah, 100%. Well, thank you so much, Dr. Karp, for sharing your experiences and insights with us today. It's been a really amazing and inspiring conversation, and I'm sure that our listeners have learned a lot. And I really appreciate your time and all the incredible work that you're doing in this field.
Absolutely. Thanks for having me, and I hope we can continue these conversations.
Yeah, thank you again. And to our listeners, thank you for tuning in to this episode of Ask a Neurologist with Dr. Karp. We hope to see you next time.